Good evening, Bahamas. Coming up tonight, 2 more COVID-19 related deaths, the latest from the health minister. The opposition's deputy leader predicting a higher rise in unemployment, plus inner city residents feeling the brunt of the pandemic.
Our news is brought to you by Alive.
Welcome to Our News and thank you for joining us. I'm Kyle Joaquin. The death toll from COVID-19 jumped by 2 today after 2 men in their early 50s died in hospital, bringing the death toll to 11. One of the men contracted the virus while in hospital. During a press conference this evening, Health Minister Dr. Dwayne Sands revealed that there are also 2 new confirmed cases. A 50-year-old woman and a 29-year-old woman, both live in New Providence and remain home in isolation. 15 of the country's 70 confirmed cases are healthcare professionals, and over 200 of them remain in quarantine.
The more adherent we are to these interventions and initiatives, the sooner this will end. And then we will have to be deliberate and cautious and careful in a methodical rollout of the reopening. At this point, we have no time for that.
96 physicians, 62 nurses, 4 EMTs, and 8 lab technicians from PMH alone have been placed in home isolation. In light of what occurred over the weekend, where a ward at PMH was closed after 3 patients contracted the virus from another patient who tested positive and another patient at Sandilands Rehabilitation Center, we asked the health minister why doctors have been sent home in isolation for 14 days instead of being tested.
All doctors will be tested, and we have started testing. We would have gotten the list of all of those, not just doctors, but healthcare workers. And so we intend over the next few days to complete the testing of all exposed healthcare workers.
Though 14 people have recovered from the virus in the country, Ministry of Health consultant Dr. Merceline Del Regis said Bahamians can expect lockdowns and curfew to continue beyond April. Health officials have found a cluster of cases in a private institution and are said to be testing everyone within that center. And as for just how close we are to flattening the curve, Del Regis showed a projection which explains that cases in the Bahamas are still on the rise.
We should expect that the increase will continue and will be greater, given the situation in the medical surgical wards at Princess Margaret Hospital, as well as the increased testing that is projected.
Health officials have also recommended no further relaxing of restrictions as the country moves forward. Expansive testing is underway on the island of Bimini. As it pertains to Grand Bahama, there have been 4 recoveries there so far, and by tomorrow, the health minister says 6 COVID-19 beds will arrive on the island. With more businesses open, Sands spoke to the importance of those in home isolation remaining at home.
Those in quarantine and isolation should request a family member to complete shopping for essential items. If this person lives outside your home, ask them to leave the groceries and other items at the door and to leave.
Well, Progressive Liberal Party Deputy Leader Chester Cooper is projecting a 50% rate of joblessness in the Bahamas as a result of the COVID-19 pandemic, which has forced business closures across the country. He suggested estimates given by the Labor Director are too low. Giorgio Bain reports.
Cooper was responding to Acting Director of Labor John Pinder, who projected on Wednesday that the unemployment rate would jump to 30%. Cooper said he was surprised that the projection was so low.
I'm not surprised by the commentary that joblessness is up 300%. I'm surprised it's so low. My projection is that it's going to be in the region of 50%. This, of course, is a very fluid situation. We have to continue to monitor the trends. We know that tourism is completely flat given that the borders are closed.
Cooper said the truth is it's going to get worse before it gets better.
It's really a question of how long this is going to last. It's not a question of whether it's going to get worse. As I mentioned, we anticipate that it will get worse before it gets better.
The unemployment rate in New Providence increased to 10.7% in December 2019, according to the Department of Statistics. From hotels and major organizations to small businesses, employers have been forced to temporarily lay off thousands of employees due to the coronavirus pandemic. Cooper suggested that joblessness will likely get worse as the year goes on.
Most business persons have written off 2020, so they're looking to 2021 to begin a new start. In terms of joblessness, I think that is what it is at this point. It's incumbent upon the government to provide all the necessary support in terms of increased budgets for social assistance and unemployment. And then, of course, we have to be our brother's keeper.
The government closed the borders as the COVID-19 situation worsened in the Bahamas. Cooper said he doesn't expect any significant changes on the tourism front until the end of the fourth quarter.
The epicenter of the pandemic is now in the U.S. So what is going to happen is, as the U.S. get their situation under control, we will anticipate the reopening of borders to allow tourists to come. I don't anticipate that that's going to happen until towards the end of the year, certainly after or thereabouts Thanksgiving.
Reporting for our News, I'm Georgie O'Bain.
Residents of the inner city are feeling the brunt of the COVID-19 pandemic. Bethany McDermott sat down with a laid-off single mother of two who said her savings is drying up and she has no choice but to rely on God to get by.
35-year-old Tia Johnson was a bartender and is now out of work after the bar she served drinks in was forced to close due to the effects of the COVID-19 pandemic. The single mother of two says it has been difficult making ends meet. She said she is now surviving off of her rapidly dwindling savings.
It's been a bit difficult, but I'm grateful that I have life. Thank God for it. But it is a struggle and it's a little hard. But thank God for the person I is to save. And that's what I'm falling back on. And a little help from my MP, Mr. Travis Robertson. I am grateful.
Stressing that these are hard times, Johnson said she's concerned as to how she will pay this month's utility bills. Her only option, she said, is to rely on God.
For right now, I can't really say or even imagine for right now. But like I say, it's a bit rough, but we get through it with God's help. But for the bill situation, I can't really even comment on that yet.
The lifelong Baintown resident added that it's extremely difficult to get help from social services.
If I need help from social service, I'm not going to tell no lie, I wouldn't even go. I wouldn't even go because they are there to help the people, but they are not. It's difficult. Even before this crisis hit, I went to social service before. And that was my first and that was my last, and I promised to God, as long as He give me health and strength, I wouldn't go back.
Despite the hardship brought on by the pandemic, Johnson says now is the time for Bahamians to band together and be their brother's keeper.
The Bible speaks about it, saying you're supposed to be your brother keeper. But how does crisis happen? In this time, we are supposed to be our brother and sister keeper, because if I got it and you don't have it, I can help you in the best ability to try, help you and your kids. So if I could do it, I will do it. And I feel as if we get together, we stick together, and we help each other, the world will be much better.
Reporting for Our News, I'm Bethany McDermott.
The Organization for Responsible Governance has partnered with the Head Knows Foundation, Bahamas Strong, and technology firm Think Simple to develop a COVID-19 self-screening website. It features 7 short questions to assess a person's symptoms. Greg Michelier of Think Simple said his firm developed the website with a goal of providing data to the Ministry of Health that could show them where to ramp up testing.
We're gathering data to identify high-risk communities, which have large concentration of elderly people, pre-existing conditions, basically people who are at higher risk and require additional protection as well. So that's part of the initiative. So identifying people with symptoms, identifying people with pre-existing conditions, people who may have come in contact in the last 14 days.
BahamasTogether.com has screened over 3,000 people since launching. While your identity can remain anonymous, the website does require you to list your area, age, and sex. Michelier said all data is protected and Ministry of Health information is posted in the event someone needs it. As for concerns over persons leaving the house when they are supposed to be in quarantine, Michelier said they have looked into technology being used in other countries.
And they are kind of using it in Singapore as well, to be able to, if you have been in contact and you have answered you've been in contact, or you in the last 14 days, and you do go out in public, that it will kind of notify people around you that, you may have, there might be someone that has COVID, but there's also privacy issues, etc. So it's definitely doable, but not an easy task.
The country has reached a critically low level of blood supply, according to the Public Hospitals Authority, which is aiming to collect 100 pints of blood. In an effort to reach this goal, the Blood Bank of Princess Margaret Hospital will hold a national blood drive at Thomas A. Robinson Stadium on April 29th. The hospital says it will conduct pre-screening for donors to ensure they are healthy enough to donate blood. Pre-registration and appointments are required to donate. Officials say you should not attempt to donate blood if you are coughing, have a fever, or difficulty breathing. Still to come, a local doctor calls for a 2-week shutdown, plus head knows helping those in need. Stay tuned. Former U.S. military medic and co-chair of the PLP's COVID-19 task force, Dr. Melissa Evans, is warning that the country needs to go on full lockdown if there is any hope of stopping the current surge of COVID-19 cases. Dr. Evans asserted the decision to relax some restrictions this week will do more harm than good. Jasmine Brown reports.
Dr. Evans says if the country truly wants to conquer COVID-19 once and for all, the fact of the matter is tougher decisions need to be made, like locking down the country completely for at least 2 weeks.
In order to really damper down on this virus, we need to completely confine. And I'm talking about aggressive confinement for a period of time, 15 days to 30 days, and you will see without that community spread and the incubation period that we look at, you will see that this virus will not be able to shed and transmit as rapidly as it has.
Dr. Evans, who has degrees in health science, global health, and epidemiology, says the 15 to 30 days is the best course of action in order to truly make a dent in the community spread. As she says, everything needs to be shut down.
I'm talking about aggressive confinement, which means that we're completely closed.
The country's new normal rotates between a 24-hour curfew during the week and a more restrictive lockdown on weekends. But on Sunday, Prime Minister Dr. Hubert Minnis announced that some of those restrictions would be eased, even as COVID-19 cases continue to rise. Auto parts stores, hardware and home stores, and plant nurseries have been allowed to open on certain days. But Dr. Evans says now is not the time to relax any restrictions.
This is something that really probably shouldn't be happening at this time. We need to continue confinement until we've peaked. Right now, by relaxing all of the emergency orders and allowing people to congregate, we are in essence setting up our population for herd immunity almost, and I think that's a very scary thing.
Evans says while the lockdown is completely necessary in her view, she doesn't believe it should be sprung on Bahamians. In fact, she says they should be given time to prepare, especially those who are less fortunate. Dr. Evans also said there were some things done right by the government, like the decision to close schools until further notice and the constant communication with the public. Reporting for our news, I'm Jasmine Brown.
Well, the COVID-19 pandemic has dealt another blow to Abaco residents still struggling to recover from Hurricane Dorian. The Head Nose Foundation says it's doing all it can to help evacuees, but donations are down. They're now appealing for donations as they not only want to help Dorian survivors, but those affected by COVID-19. Jillian Gray reports.
Months after the passage of Hurricane Dorian, survivors from that deadly storm are still trying to rebound. Founder of the Head Knowles Foundation, Gina Knowles, said many people are still in need, but the COVID-19 pandemic has made things increasingly difficult.
The volunteers, the international volunteers, had to leave and go home, which made it a lot worse. So World Central Kitchen, who was cooking, they left, which means that leaves a lot of empty mouths. So they're having a tough time.
She urged people not to forget about those who survived last year's deadly storm. Her team has been providing help to evacuees all across the country. They have helped about 700 homes in Andros, about 300 homes in Eleuthera, and countless more in Abaco. Recognizing that the COVID-19 pandemic has dealt a harsh blow to many, the nonprofit is also beginning to raise money for workers laid off as a result of the pandemic.
The new shipments that we actually just received, some yesterday and Friday, we got it in for COVID-19, but we're covering both sides because every food item that we had for Dorian was gone, given to Hurricane Dorian victims. So in between the crossover, we actually didn't have anything left.
Donations to the nonprofit group have taken a nosedive. Knowles said they will need all the help they can get in order to assist the most vulnerable.
Us as Bahamians, if we continue to help each other and be our brother's keeper, it is a scary time. And there is a lot of ways that you can help. People think that a lot of people sit behind their keyboard and complain about others helping, but yet they're not helping. And it's very easy to help, even down to time. Like what you said with volunteering. If you want to volunteer, reach out to us on our Facebook page.
Reporting for our News, I'm Jillian Gray.
All right, thanks, Jillian. Still to come, the PLP distributes care packages to thousands of residents, plus how one Junkanoo group is helping its members. Stay tuned. You're watching Our News. Welcome back. The Progressive Liberal Party headquarters has been transformed into a COVID-19 grocery packing center. PLP leader Philip Brave Davis said it was time to put their words into actions.
We decided not only just to talk about it, but to do something about this. And what you're seeing now is what we are doing. We're not talking about the hurt. We are doing our small part to alleviate some of the hurt. And hopefully, in due course, the government will kick in and do their part.
Boxes stacked to the ceiling and divided into each constituency were loaded onto trucks, then taken into the communities for distribution. Davis said care packages were also sent to the Family Islands.
There are names of persons that have been provided to us for the purposes, and they'll be carrying these care packages directly to those homes in all of the constituencies through the island of New Providence. We already have more than 2,000 pack, and that will be going. That'll be going out here in New Providence. We have already sent about another 1,500 to the Family Islands, and as needed, we will step in to help as we can.
A Junkanoo group is collecting donations from its members for other members who are in need. Jared Higgs has more.
These may be basic food items, but for many, they are greatly needed.
We are here to help you. We are our brother's keepers.
With thousands of Bahamians out of work due to the coronavirus pandemic, many families are struggling financially. Some Roots Junkanoo group members are in those ranks.
We won't be a Junkanoo group if it wasn't for our members. We could have costumes, but they cannot parade themselves down the street.
Group Secretary Shanda Swan says the organization isn't leaving its members hanging. The group's community service faction is putting together dozens of care packages. It's a team effort and everybody is pitching in.
We had group members who donated items, as well as we had group members who donated funds. And then we actually designate people to go and shop for the items.
It's also a discreet operation. Those in need can contact a trusted group member and have help brought to them.
So we have representatives from each section who will then go and deliver it to each member so that we can eliminate the amount of persons on the road.
About 7 group members met for packing. Grits, cereal, corned beef, tuna, craft dinner, and even fresh vegetables were on hand. Some members told us why they wanted to help.
We want to always ensure that our membership knows that we're thinking about them, we love them, we care about them, and that if they're going through a tough time, then we're going to do our best to ensure that we help them.
It's important to give back to those who don't have, and in this time it's really because a lot of people, especially the hotel workers, who are now out of a job and they don't have it.
We're giving this genuinely from our hearts. We love and we show and we care.
Now, the group says it will continue this initiative for the next 4 weeks, but if its members need more help, it'll do what it can. Reporting for Our News, I'm Jared Hayes.
All right, thanks, Jared. Still to come, the women of Baintown receive some basic essentials. Stay tuned. Over 100 packages of feminine hygiene products were handed out to the women of the Bain and Grandstown community today. It was a part of an initiative by the Dignified Girl Project, which was designed to help better the lives of women and girls nationwide.
There's been pleas from all over for corporate persons and NGOs to do their part and help to meet the basic need that our communities and individuals in our communities have. So being a nonprofit organization, we decided that we wanted to do our part as well. We wanted to serve our communities, our fellow Bahamian, and help make the burden just a little bit lighter during this time.
Women in the Baintown community lined up outside the constituency headquarters of the area's Member of Parliament, Travis Robinson. He said after passing out 500 hot meals on a daily basis, he's glad more community-based groups are stepping up to help those in inner-city residents.
We've had tons and thousands of persons who have been born and raised in Bain and Grandstown and have grown up and done well for themselves and now have moved out of the area. And so we're calling on those persons to come back and to give back to Bain and Grandstown that has given so much to them over the years.
Thank you for joining us for Our News tonight. On behalf of the entire team, I'm Kyle Joaquin. Remember, you can catch Our News on the go with the RevGo Play app. Stay tuned for a brand new episode of On the Record with host Jerome Sawyer. Have a good Thursday evening, Bahamas.